Hello friends, let us now learn some important points about the sympatholytic drugs. So in the sympatholytic drugs, we have two different types. One, we have receptor blockers, which include alpha blockers and beta blockers. Second, we have adrenergic neuron blockers. So first, in adrenergic neuron blockers. Adrenergic neuron blockers include one, these are the drugs which will block the adrenergic neuron. That means if this is the presynaptic membrane, neuron, then first there is uptake of tyrosine. Tyrosine enters the neuron, and this tyrosine inside the neuron, it undergoes series of reaction to form dopamine. This dopamine, in the presence of dopa decarboxylase, it forms norepinephrine, and finally norepinephrine enters the synapse and it activates alpha and beta receptors. So first drug, which is adrenergic neuron blocker, is mid-tyrosine. Mid-tyrosine will inhibit the tyrosine uptake. Second, the drug carbidopa will inhibit the conversion of levodopa to dopamine. Then third, the drug reserpine inhibits the dopamine vesicular uptake. It inhibits the dopamine vesicular uptake, and thus it decreases the sodium and dopamine. It inhibits the vesicular dopamine reuptake is inhibited by reserpine. This reserpine, in the long term, it is used in cancer. If it is used for longer time, it can cause cancer. The side effects are it causes depression, suicidal tendencies, decreased dopamine, or extrapyramidal symptoms can occur. There can be it can cause increased prolactin, galactorrhea. It can cause galactorrhea, gynecomastia, and sodium and water retention due to hyperprolactinemia. Then the next drug includes guanethidine or guanedril. Guanethidine or guanedril. This guanethidine and guanedril will inhibit the release of noradrenaline. So this mainly acts by the displacement reaction, where this guanethidine and guanedril will displace norepinephrine from its site and thus inhibit the norepinephrine release. Not used clinically, it is a reserved drug for hypertension. The side effects are it can cause delayed ejaculation and postural hypotension. Then the next drug is bretylium. Bretylium also inhibits the release of noradrenaline. Bretylium is also a drug which inhibits the release of noradrenaline. Earlier, this bretylium is used for hypertension earlier, but because of poor oral bioavailability, it has not been used now. It is used as an antiarrhythmic drug, that is third generation antiarrhythmic drug. Ventricular fibrillation refractory to lidocaine for electrical defibrillation is seen in bretylium. Then this bretylium also has potassium blocking property, and thus it will prolong the QT interval by this potassium blocking property. So these are the important adrenergic neuron blockers. Thank you guys for watching my lecture. Thank you.